Hi, I'm Dr. Martin Rutherford, certified functional medicine practitioner, author of Power Health Back to Basics. You'll see I'm a Back to Basics guy, and clinic director here at Power Health Wellness and Rehab in Reno, Nevada. And we've started a series on functional medicine. I believe this is the fourth in the series. We did an introduction. We talked about what functional medicine was. This was to answer the questions of why can't you've got 600 hours online talking about all these different diseases, but you don't tell us how to get better. And I'm explaining why we can't do that by doing a series of presentations on functional medicine and how it's been classically taught, how it's taught in the classic functional medicine universities, Functional Medicine Institute. And I'm doing this because the vast majority of people who are doing functional medicine may not be following this to the nth degree. A lot of people come in here and want to know why we have to do such a thorough history and thorough exam. So the last one was on history. The one before that was on obstacles to cure. Things that you can know about a patient before they ever even open their mouth or before they ever even get into an exam, or should they even be examined. Obstacles to cure, that's an interesting one. We talked about that. This is going to be about examination. I've had an interesting week on that. I don't know if it's just because I'm focused on this, but I've had several patients in here. One yesterday was a nurse from Southern California, and she came in and she is a nurse, and she was great. And at the end she said, I know that we learned how to do examinations in school, and I know our doctors did, but nobody does them anymore. And she said, I'm going to have to rearrange my practice and start doing exams again, because it brought back to her how much data you can get out of an exam. And understand, I went to school before, when I was going to school to learn how to be a chiropractor or a doctor, it's and you may not know, but like the very first half or whatever of medical school and chiropractic is almost identical. You're learning how to diagnose, and you're learning how to do histories and exams. And when we went back, when I was going, there was no such things as MRIs. There was no such thing as CAT scans. There was no such thing as nerve conduction velocities. And we understood that even the blood testing was ballpark. And even today, the blood testing is ballpark, and that's something we may or may not get into too extensively, either now or maybe in the future. So we do an extensive history, an extensive exam. Back then, we had to make a diagnosis, and we had to do it by doing it. And it used to take at least an hour-long history exam, and then we were expected to come up with what we called the differential diagnoses, which was the three most likely options that is wrong with that person. And then ultimately that was supposed to guide your testing. It wasn't about, okay, we have a pain in the chest, chest in the pain. We have a pain in the chest, and so let's do an EKG, let's do an echocardiogram, let's do an MRI, let's do a CAT scan, all that's normal. No, you would do an exam. Maybe as a chiropractor, we would find out that the person has a rib out of place, actually sticking up here. Maybe as a functional medicine doctor, we might find out that maybe the pain is because somebody's got a gallbladder problem before we even did a gallbladder test. So this is the reason we're going through this. This seems to be a big issue with a lot of patients that come in here are usually pretty pleased, or usually like pretty blown away at all the data that you can get from an exam. And I wanted to go over this because we went through the history and how important that was. I want to go through the exam so you see what kind of data could be gotten from the exam. And again, this goes to your question of, why aren't you telling me how to fix my polycystic ovarian syndrome, or my blood sugar, or my diabetes, or my fibromyalgia, or whatever it is that you come in with? And it's because everybody's different. And it's because there are a lot of moving pieces to it, and that's something I explained in our initial two episodes in which we talked about whack-a-mole medicine versus functional medicine. Now, functional medicine, I've been to classes. I know many of the people who were the developers of functional medicine, and they all the manuals all have functional medicine exams in there. Our exam is a combination of a functional medicine and functional neurology exam because we practice functional medicine, we practice functional neurology. But the exam is incredibly important, and so I have our exam sheets in front of me here as a guide, and I'm just going to walk through this with you. And as I talk about the different areas of examination, you're going to find most of them are examination procedures that you've been through. Okay, but I'm going to go through why, from the functional perspective, they may be a little bit more important to delve into. So first thing we do when a patient comes in is we take their vitals. You go to the doctor and your vitals are taken. But the difference between functional medicine and medical medicine is pathology. Okay, the medical community, although small parts are starting to morph over towards what we're doing. It's mainly about pathology. It's mainly about, look, your tests are okay, your kidney's okay, you're only in stage 2 or stage 3 dysfunction of shutdown. We'll wait until it's like gone and then we'll do kidney dialysis. It's about you having pneumonia, we'll give you a medication for it. And I am not anti-medicine. Those of you who know me, have watched me, know that. But it is about pathology. And meaning they're waiting until you have developed something that can be cut out, radiated, medicated, or something in the area of their toolbox. We're looking for function. So, like, for example, first thing we do is we take your blood pressure. We take it seated, we take it standing, we take it laying down. There's reasons for that. There are conditions that we have called POTS that we've seen. But also we treat people for adrenal problems. And if a person gets lightheaded when they go from sitting to standing, we know if they're not having a TIA, a stroke, which they usually aren't, because that's usually be checked by the time they got here, usually that's a sign of poor adrenal function. Usually it's a sign of low adrenal function. The blood pressure also could be high. I have so many patients who've come in here and we took their blood pressure, and their blood pressure was significantly low, like significantly. And they were on blood pressure medication. And it turned out what had happened was every time they go to the doctor, they had white coat syndrome. And meaning that they got nervous when they went to the doctor. The doctor gave them blood pressure medication. And then it drove them into low blood pressure. Why is that important? Whether they're in low blood pressure because of that, or whether they're in low blood pressure because they have low blood pressure, that's not good. Doctor tells you it's great. You're not going to die of a stroke or a heart attack. I'm going to tell you we need normal blood pressure. If you have low blood pressure, you're not getting, your heart's here, your heart's here and your brain's here. You're not getting enough blood to your brain. If you have low blood pressure, you're not getting enough blood pressure to your extremities. So you're not getting oxygen to your extremities. If you have low blood pressure, it's more difficult to get nutrients to your brain, nutrients to your extremities, nutrients to push into your cells. That's what blood pressure does. Blood pressure pushes things in through to the extremities, and it pushes nutrients into the cells. Well, if you're trying to fix somebody with herbs and botanicals, or you're online, here goes to one of those reasons why you might not be telling you what to do. Okay, if you're online and you're taking all these supplements and they're not working, and you have really low blood pressure, and somebody's told you that's great, low blood pressure is not great. Low blood pressure usually leads to long-term types of conditions that just don't get better. You don't get better as well when you have low blood pressure. So low blood pressure from a functional perspective in a place where you're using nutrients and diet and you're using these types of things, if it's there, it's important. It's got to come up. And I'm not going to get into all the ways that you do that, but it's actually, in most cases, it's not that hard, and you can do your internet search for that. We do same thing. We actually do tissue perfusion. We actually try to find out. We put a device on your finger that measures how much oxygen you're getting into your finger, and we test the lungs too, how much. So most of you may be familiar with testing oxygen. We're going to talk about the basics and foundation of getting better next time. And one of those things we're going to talk about is having proper oxygen, which means having proper blood pressure, and a number of other things. This all goes to the exam. So if we find out that your tissue perfusion into your fingers and your toes is not good, we immediately start looking towards the fact that if this is something a patient decides to do, or we decide to extend care to, we're going to have to get blood into those extremities. Because I have news for you: if you're not getting blood into your extremities, you're probably not getting it to your brain, and you're probably not getting it to your intestines. And so, and you could have a normal lung perfusion. So you could have, like, for those of you who may be familiar with that, you go into the doctor and they teach you, and they check you for it, and they'll say, oh, it's 93%, and that's great. Anything above 90% of oxygen perfusion into your lungs, a capacity into your lungs, is good. We like to see it at 98%. Functionally, that's what makes everything work better. That's what makes people get better. That's more oxygen. That's what makes nutrients work better. Okay, most of our patients are in and around the 90s. Most of them are good. Some of them come in, they're not. But then we look at their tissue perfusion. Is it getting from the lungs to your extremities? And if your tissue perfusion is like almost gone, like most of our patients are, because they're stressed, because they have a thyroid problem, because they have a low blood sugar, because their T2 is low, their T3 is low. There's not even a T2. Because their thyroid hormone is low, their active thyroid hormone is low, and a number of other things, smoking, a number of other things that do it. Depending on the severity of that case, we might not even take the case if the person's not willing to stop smoking, depending on the severity of the case. If it's a less severe case, we might take them. But it's a big factor. It's a big factor to understand what's going on there. So, of course, we check height, weight. Obviously, we want to know if the person's overweight, and that leads to different things about looking for diabetes, looking for insulin resistance. Overweightedness also causes high blood pressure. So if people come in here for high blood pressure, they lose the weight. A lot of times it goes away. If that person comes in here and that's what they want to do, if that's what they're in here for, is weight loss, then it starts to let us put the puzzle together as to what's going on. We auscultate the heart. I do believe, so I'm not a medical doctor. I don't try to be. We do a very thorough evaluation and exam. I work very well with the medical community where I am. Very good relationship here. We do a full evaluation. So we check the heart. Actually, the heart is not something that we directly, even though people might come in here with coronary artery disease, the heart's kind of like at the effect of everything else. So we'll check the heart. It may or may not be something valuable for us to know, but if we find something that the person has a problem with, we have a hospital about 6 blocks from here, 10 blocks from here, whatever it is. We look for, things along those lines. We check people's veins, we check people's arteries, because we want to know if there's blood flow getting to different people. Now, one of the bigger things we do is we palpate the thyroid. Now, this is functional. I'm talking that we're in the world of functional, though. But we palpate the thyroid. A lot of people are surprised. A lot of people come in here for thyroid problems. My mentor, Dr. Datis Karazian, was the original Hashimoto's guy. I don't know if it's out of the picture, but his book's sitting right up here. Why do I still have thyroid symptoms when my lab tests are normal? He could have called it, why do I still feel like crap when I'm taking all my medication and my lab tests are normal? But thyroid's complex. The vast majority of them, clinical pearl for you, the vast majority of them are Hashimoto's. Whether you have come to that, to embrace that or not, or you've ever heard of it. And so we palpate the thyroid. People are shocked a lot of times that no one's touched their thyroid yet. If it's enlarged, if it's got nodules, there are certain things that would alert us to the fact that maybe it's pathology and maybe it needs to go and be checked. But if it's enlarged and it's tender, and we look at the sheet that we went over last week, and we look at that history sheet, and they have 18 out of 20 symptoms of Hashimoto's, and their thyroid's tender, there's about a 99% probability that person has Hashimoto's. And that's something really valuable to know, because when we move into the testing, at some point, we'll talk about testing. You can test for Hashimoto's, and you can be full-blown Hashimoto's, and your test can come up normal, like the book says. Okay, so in our world, because we don't use drugs, we use herbs, we use botanicals, we use diets, we use brain rehab exercises. We'll talk about that later, because we do functional medicine and functional neurology. But I think most of you listening here are interested in the functional medicine. That allows us to start to advance our treatment, even though the test would be normal, because we would have the history. This is where we start to understand. We would have a history. It says 18 out of 20 things say the person's got a thyroid problem. We have a palpation here that says you have a thyroid problem. Maybe we need to send you out for a nodule that feels like it might be a potentially 1 in 100 chance of cancer. But for the most part, if you're inflamed, the chances of you having Hashimoto's is high. We can start in that direction safely, and frequently get some sort of results in very early on. Now we palpate people's lymph nodes. What do we do for a living? We treat our office is kind of like we try to treat mystery diseases. We treat fibromyalgia, the diseases where nobody knows what it is. We treat fibromyalgia, peripheral neuropathy, chronic fatigue. You can look online, vertigo, dizziness, balance. But all of these have unique components. By the time a patient gets here, usually they have unique components of autoimmunity, and they usually have unique components of chronic stress responses, one or the other or both. We're going to palpate the lymph nodes. And if we have a history, a person has their tonsils out, their adenoids have been out, or they keep inflaming their throat, their lymph nodes are swollen, all this came on after they had a baby, or if they had an accident, or have something like that, we know they have autoimmunity, but my doctor says I don't have it. My test came back normal. Well, we can't afford that here. I mean, by the time a patient gets here, they've been told everything is normal and all their testing is normal, and there's nothing wrong with them. Here, take these drugs. Palpating the lymph nodes can be very, very valuable, and it's something that we do on every patient. And if it's correlative with their disease, but they've already been checked by their doctors and they don't have any pathological diseases, guess what? They probably have an autoimmune problem going on. So that's valuable to us. We look at their eyebrows. It seems like now a lot of folks know that if the outer third of your eyebrows are gone, or if your eyebrows just kind of go away, there's a good chance that you have a thyroid problem. It's a very cardinal sign of thyroid. And it used to be considered a cardinal sign of hypothyroid, and it still is. But the statistics are that if you've been diagnosed with hypothyroid, there's about depending on who you're following, there's an 85 to a 95% chance you have Hashimoto's. And so again, this is diagnosis. You have a person sitting in front of you, you know what the research says, you've got the history, you've got the exam. You should be able to come up with those 3 differential diagnoses still today, even though we have all these wonderful things to confirm. You should be able to come up with those differential diagnoses for the functional medicine patient, so that you can delve into their case with an organized approach, an organized understanding of the probability of what's going on with them, and know more or less precisely what testing you should do. Not having standardized testing, this helps us to do that. We auscultate we inspect the abdomen, we inspect it to see if there's any surgeries there. We ask about surgeries. Stretch marks, I'm not sure if you're aware of this, but stretch marks frequently indicate autoimmunity. There are women who get stretch marks, and there are women who don't get stretch marks. There are guys who get stretch marks when they lose a lot of weight. But basically, this goes to the patient who has had surgeries. They get a surgery, and then like a year later, they have scar tissue, and then the scar tissue comes back, and they have to keep getting it cleaned out. It's similar to what happens with those stretch marks. So if we see those stretch marks, again, right then and there, we're thinking, okay, we may have autoimmunity here. So this is, hopefully this is kind of a new understanding to you, because a lot of people come in here and they're confused, rightfully so, about autoimmunity, because autoimmunity is confusing. That it's what has complicated our life here over the last probably 30 years. and it's something that the testing is still in its infancy. Everybody comes in here and says, well, my rheumatoid arthritis test was normal, but then it wasn't. And that was normal, but then it wasn't. My lupus test was, I have all the signs, but my lupus test, look, if you have the signs and you have the symptoms and you're having the rash and you're having all those things, you have it. But doctors will be hesitant to diagnose you with it. And thus, if they won't diagnose you with it, they're not going to hit you with a bunch of steroids because they're going to be afraid if they make a mistake, they're going to get sued. So in functional medicine, we're not going to do anything that's going to hurt anybody. We can take those steps forward. So we inspect the abdomen, we auscultate the abdomen, and what I mean is we listen to the abdomen, and basically in the end we're looking for the churning, the gurgling sounds. We're listening to see if they're there or not. If they're not there globally, okay, if they're not there throughout the entire intestines, that person is in a chronic stress cycle, because basically their brain is shutting down something called the vagus nerve, and when you're in fight flight, there's a part of your brain that's going really fast, but there's another part of your brain that's supposed to be making you relax, that's not at that point in time, so it's being overwhelmed. That part of the brain that's being overwhelmed is part of the brain that makes you have nice bowel movements. It's part of the brain that makes you sleep. It's parasympathetic nervous system. If you don't have auscultation of sounds in there, then you are we know you're in fight flight. If we shake your hand during the exam and your hand is moist, in some of your cases slimy, not to be derogatory, but I mean most of the patients who have that actually will describe it that way. We know you're in fight flight. We know that you have a chronic stress response going on. This is incredibly important to both functional medicine and functional neurology practitioners, because functional medicine practitioners will start to use herbs and botanicals to try and get it under control. Functional neurologists will try to do brain rehabilitation exercises. In our office, we've chosen to complicate things. The only thing I do that's not simple, and put the two of them together, and that for us, that seems to work better in getting that fight flight under control. But you can tell, in an exam, is the patient sweating? Are their feet cold? Are their hands cold? I told you that you're not getting blood there when your hands and feet are cold, or when they're not getting enough oxygen in there. But what causes that? Two main causes of that is chronic stress responses and and thyroid, and misdiagnosed or mismanaged thyroid. So again, this goes back to, you're telling us all about the thyroid, and you've told me about the thyroid. Why can't you tell me, how to take care of it? Well, what's causing that cold? Is it thyroid? Is it stress responses? That requires a little further investigation, and then each one would require different treatment. So if you tell me, I got a headache and my hands and my feet are cold, and I got a migraine, I can't tell you a whole lot from that online. Although I know people that would be happy to shove about, 5 or 10 or 15 supplements at you and go, here's what you take. That's really not the way functional medicine was designed. This is the way it was designed. So a decrease, and by the way, for those of you who are astute diagnosticians, I am aware that if we do have an absence of bowel sounds in one part of the bowel but not the others, that's a bowel obstruction, and you should go to the hospital right at that point in time. We do a palpation of the abdomen. We actually palpate every single thing in the abdomen. People are shocked. They've been to gastroenterologists, they've been to their GPs, they've been everywhere. Nobody's touched their abdomen. They're in here and they have all kinds of abdominal symptoms, and sometimes they might not have a lot of abdominal symptoms. And then we palpate. We palpate their large intestines. We palpate all of their small intestines, their ileocecal valve, their liver, their gallbladder, the bottom part of their stomach, all the things you can palpate. And if they're inflamed completely there, that's diagnostic. We know there's going to be inflammation. We're going to be looking for inflammatory markers, but there's a lot it tells us there. You cannot have that much inflammation without having a leaky gut. You can't have a leaky gut without developing food sensitivities. And so from a functional perspective, that starts to give us insight into the case. Now, if it's just parts of the intestines that are tender, that tells us something, because A tender large intestines tells us different things than a tender small intestine tells us, and one causes different types of symptoms from the other one. One might be small intestinal bacterial overgrowth. One might be irritable bowel syndrome. One, you might be in an area where you go, ooh, we better start looking for ulcerative colitis, or celiac, or Crohn's disease, or something along those lines. And yes, you can tell things. You can tell a lot of things from palpating the abdomen. A lot. We observe people. Do they have like alligator skin? Do they have places that are there okay? Do they have alligator skin, or do they have flaky skin on their shins? Okay, flaky skin on the shins, folks, is, and now we live here in the high desert. So here in Reno, we're like right where the high desert starts. We have these beautiful mountains on one side that have all these trees, and we have mountains on the other side that are totally barren. It's the desert. Okay, and we're 4,000, we're 4,000 feet here, something like that, and so everybody thinks it's the desert. Everybody thinks it's the dry air that we get, but it's not. The vast majority of the time, it's their thyroid, or it's a lack of essential fatty acids, and you'll understand why essential fatty acids are important to us in our next episode, because we're going to talk about foundational things for you to get better. Essential fatty acids is one of those. So that can tell us. We compare that to their history, and we go, whoa, we have to pack these people full of fish oil before we get going to be able to get their essential fatty acids up, something which we'll talk about before. But we saw that. And we've already palpated their thyroid. Do they have a thyroid problem or not? Well, it looks like it might be thyroid, it might be essential fat, but we can test for it. We now know, okay, we should test them for essential fatty acid deficits, or we don't. They're fine. We look at their feet, or their feet turn blue and cyanotic. Does it change when they go from sitting to standing? If it does, we know, again, that we're looking at a stress response. So we look at their nails. We look at your nails. If your nail health isn't good, we look at that. That has a number of different meanings, which I won't get into all at this point in time. Let's see. So I think those are the main ones from a general functional medicine perspective. You generally you would generally observe the patient for, do they have energy, are they slumped? You'll look. We do a neurological exam too, but some things cross over. The one thing that we did do, or that we've done from the beginning in functional medicine, is look in people's eyes with a little pen light. And if your eyes dilate and they stay dilated, or they don't contract when we put the pen light in there, then that means that your brain is in chronic fight-flight. For those of you who watched us, know us, that's a big deal. For those of you who don't know us, what we have found is being in a chronic stress cycle is the X factor. We've been doing this a long time, so we tend to get people who've been to other practitioners, and many other practitioners who may have found a gut problem and did the right thing with them. They gave them the right herbs, they gave them the right botanical, they put them on the right diet, and the person's gut either felt better for a little while and then didn't, or never got better. And there are a number of reasons for that, and it can be confusing for the practitioner if they don't realize that a fight-flight mechanism will flood your system with stress hormones. It'll cause inflammation, it'll cause constipation, it'll cause decreased blood supply, and you're fighting that brain. Okay, so you need to have more than just a form or just an adrenal stress test to know if that person's brain is in fight-flight. Adrenal stress test, for those of you who are more schooled in these things, tells us about the brain, but it tells us more about something called the hippocampus and the amygdala and the hippocampus, mostly hippocampus, and how that's affecting your adrenal glands. And that's for those of you who are already schooled into that. For the other ones, I'm sorry for going off into that area. We do reflexes, okay? We do. Well, if a person has global reflex decreases, usually it means, to us, usually means they have a lack of oxygen. And so these are physiological aspects. You hear me talk about oxygen. You didn't hear me talk about blood sugar today, but that's foundational. We talk about essential fatty acids. We talk about picking up thyroid. We talk about picking up a probable leaky gut, picking these things up on the exam. And we've already talked about the history. History and exam are supposed to go together. Now, I'm not going to go into this extensively. We also do functional neurology, and in our world, we have found that doing the brain rehabilitation exercises in more significant stress cases tends to be very successful well, contributes to success, let me put it that way. And we do peripheral neuropathy too. And peripheral neuropathy is largely neurological problems where you're having abnormal nerve pain, mostly in your feet and shins, and sometimes into your hands. So we do a classic neurological exam for that, which is appropriate. But I am surprised at how many people come in here and they don't know whether they have peripheral neuropathy or not because they went to their doctor and the doctor did a nerve conduction velocity test and an EMG. So for those of you who aren't familiar with peripheral neuropathy or that, you might get numbness, tingling, burning in your hands or your feet, mostly in your feet. You might get numbness. And then these tests stick needles in there and they find out if electricity is going to your muscles or they find out if your nerve's not working right. These tests are, they're not real accurate. So they can tell you if you have it sometimes. They can't tell you where it is, and they can't tell you what kind it is. And there's 80 different types of peripheral neuropathy. You can get enormously more data out of an exam. So for example, and the exam is so simple, it's like ridiculous. You can do hot and cold temperature testing on the person to see if they're not sensitive to it or too sensitive to it, to heat, to cold. Either one of those means your small fiber nerves, if they're abnormal, means your small fiber nerves are breaking down. If somebody's hitting you with a pin and you're uber hypersensitive, you're in the early state. You may be in the early stages of small fiber neuropathy. If you don't feel it at all, you may be in the later stages of it. If your reflexes are absent, you probably have small fiber neuropathy. If somebody puts a vibration plate, a vibration tuning fork on your toe, and it doesn't work, you don't feel it, that's a large fiber, but it also happens to be something that is involved a lot in small fiber neuropathies. So the point is, not that I expected you, I'm not saying this so that you grasp each one and write it all down. That's a small fiber neuropathy evaluation. You can actually make a diagnosis off of doing an exam. I go back to the fact that in the day, that's how we had to diagnose a small fiber neuropathy. And there are other things that will tell you if it's a large fiber neuropathy. That exam further will tell you, is it the low back that's causing that person's leg problem, or is it that they actually have a neuropathy and a small fiber neuropathy is in the low back? It's either thyroid or it can be thyroid, or it can be, believe it or not, gluten. It can be autoimmune. Most commonly it's prediabetes. And there's a handful of other things that can be. It could be bad bacteria in your gut. It could be food sensitivities. But there's only about 8 things it is. So now you've done a diagnosis through an evaluation. You've found that the person's probably got small fiber neuropathy. You double check it with their history, and you go, yes, small fiber neuropathy. Let's go. Or there are actually better tests for that. They're extremely expensive. They're not completely accurate. So we can decide with the patient whether we go and do those tests or not. I have a little bit more, I think, a willingness to go with the exam and the history and targeted testing, simply because that's the way I grew up. That's the way I was taught. It was normal to me, and I've been through the world of all the tests are normal, or even I am a chiropractor. Too, and so even when I was doing strictly musculoskeletal, I can tell you the number of people who came in here and they had a 9mm disc in their back that the doctor was pointing out. That said, that's the problem. They took the surgery and nothing changed. We did an evaluation on them and found out it was muscle, and put the person through a mini 2, 3, 4 week rehab, and they were fine. So just looking at the MRI in that case was a disaster. They did not do an exam to find out that all of the testing for disc problems would have been normal. they would not have been. They would have not have shown. They probably and they shouldn't have taken out the disc in that case. This goes like 10 times for functional medicine because we're working with things a lot more vague than a back problem or an obvious disc problem. So, and one thing we do in functional neurology, and again, I realize most of you are probably here for functional medicine, but this kind of crosses over. The one thing that we do there that really translates to, and this is not something that's commonly taught out there. So don't go asking your functional medicine doctors why I didn't do this. We actually evaluate the cerebellum. Okay, you can look up the cerebellum. It's like 80% of the brain function is directed by cerebellum. Or I should say 80% of the neurons in your brain are like in the cerebellum. It directs brain function. It has projections into every area of your brain. If your cerebellum's off, you can get, and you're the person, you can get dizziness, vertigo, balance, migraines. You can get the chronic neck problem. That's that stiff neck that causes suboccipital headaches, the tension headaches that people get. You can get blurred vision because it controls your eyes. You can get chronic stiff neck and chronic back pain that won't go away because it controls all of your spinal posture muscles, all things which we treat, right? This is one of those, why don't you tell me how to fix it? When you tell me the condition and you talk about vertigo and dizziness and balance, why don't you tell me how to fix it? Because it might be your cerebellum. How would I tell you that over online like this? And the cerebellum, and the reason it's so important to us, and the reason it should be important to more functional medicine doctors, although in all fairness, this is not taught in the functional medicine classes, is that if you have Hashimoto's thyroiditis or autoimmunity, there's an awfully big chance that your cerebellum is going to get attacked. I'm not going to get into that. We have hours online on all of these things I'm talking about on powerhealthtalk.com, and we have all the peer-reviewed references and all the journal references attached. Thanks to my former colleague who did all of this research, and so it's pretty solid, and we see it every day. So it tells us if that person's already been to the ear doctor, or they've been to the brain doctor, they've had the MRIs, they have the CAT scans, everything's normal. And my doctor told me my cerebellum is normal, the MRI is normal, the CAT scan is normal, it's all normal. And then we have the patient close their eyes. We have a foam pad here. So a lot of your balance comes from your ankles, believe it or not. A lot of your stability comes from your ankles. So we have people stand on this foam pad to take that ankle stability out. We have them close their eyes and put their hands next to them. And half of our patients, we have to catch them before they hit the ground. They're in shock when that. I've had an Olympic athlete actually do that, and he was majorly in shock. That's a bad cerebellum. And if you have a bad cerebellum, it can be a contributor to all those things I just got done talking about. And sometimes it's because of all concussions, but much of the time it's because there's been an autoimmune attack against the cerebellum. Now, these are the types of things. Now, I've talked you through this, and I could talk you through a little bit more, but basically, I know this is the most exciting subject, but basically, I've talked a lot about, and if you went back and looked at the history and all of the things that you get out of history, and then you look at all the things that you get out of exam, I could stand here and actually treat most cases without going any further and doing any testing. And because you have a pretty solid understanding of what you're dealing with. In functional medicine, you should be dealing with global issues. You should be dealing with feedback loops. You should be dealing with vicious cycles. You should be dealing with organ systems. You're dealing with big global systems that are spreading out and causing a lot of problems. And so you should have a very, very clear idea of what those systems are by the time you're done with this. The reason why am I going through this? I'm kind of going through this so that you understand this whole series, so that you understand, what you should be getting. I think if you're going to a functional medicine doctor, and they're charging you what they're charging, and they're treating you, you might want to know if this feels like I'm getting the full service, that or if somebody starts like feeling like they're maybe guessing or stuff. It's likely because this hasn't been done. Because by the time you're done with this, you should have an extremely good idea of what's wrong with the person. And I do testing, but our testing is very targeted. We just have one test, and I'm not going to talk about that this week. I may talk about it in the future. We have one test that we do for everybody. It's a comprehensive blood panel that we put together for our patient population, which is people who are chronically ill, usually have autoimmunity, and usually are under chronic stress. And beyond that, the rest of the testing is based off of what we find here. And the testing in functional medicine should tell you what you need to know to treat. It shouldn't be, I got to test this to find out what's wrong with you. In occasions, you certainly need testing to confirm. But as you could probably understand, you have a pretty good idea of what you're testing for, as opposed to you walk into the doctor, you talk to him for 7 minutes, you got a rash on your face, and he goes, let's test you for lupus. Well, that could be like 10 different things or 15 different things. And if you did this exam, you would probably narrow that down dramatically. This changed in the 1990s when the HMOs came in, and we started having. I remember I'm sitting here in Reno, and I have a nurse in Chicago telling me how I need to treat this patient. At that time, we were doing insurance, and that's why we don't do it anymore. Okay, and then I'm thinking this is malpractice, and it was malpractice. But they've changed the laws to where it's not malpractice anymore to treat somebody that you've never seen, haven't done an exam on, or haven't taken a history on. It's insane. But that's another story for another day. So that is generally what I wanted to share with you. I wanted to get a gist of an exam, why it's important, why people should be doing it. Sorry, your doctor should be doing it, your GP should be doing it, everybody should be doing it. They know they should be doing it because they were taught that. They were taught that in medical school, they were taught that in chiropractic college, they're taught that in naturopathic college. Functional medicine doctors are taught that in functional medicine classes if they take a functional medicine university, Functional Medicine Institute. Arizona has a nice program, or if you're to a naturopath, all of them teach to do exams. Okay, and so I'm not talking out of school here. We do talk in previous seminars about maybe checking your functional medicine practitioners out and making sure that they actually have at least a couple of 100 hours. In this state, you can't say you're a functional medicine practitioner unless you have, I think it's either 220 hours or 120 hours, but you have to show that you have gone through all the basics, passed some tests, that you have a grasp for the foundation of functional medicine, and this is part of that. So that's going to wrap it up for this episode. Now next week we're going to start getting into quote unquote treatment, okay, and we're going to start laying the foundation. Classic functional medicine is not treating people if the foundation has not been set. This is the cause of more failed cases than I can even begin to tell you about. And next week we will share some of those cases with you, and we'll talk about the foundational aspects of getting well, probably period, but for sure the foundational aspects of getting well in functional medicine. So that's it for this week. And if you have any questions, if you have anything that you think you've watched these, there are things that you think you might be interested in that I can wrap within the framework of this series of teachings, I'm open to that. If you have any comments, don't comment to me on I'm not sharp or anything like that. I'm not here to be do a show. I'm here to share with you what we have found over the years. This is my 40th year coming up in practice, so I'm just sharing with you what we know, what we've done, what we see, and so it can help you out there. This is the request I've got. This is our answer to it. So we'll see you next week, and I hope that was interesting to you. I hope it was. It should be. It should be. And if it wasn't, maybe watch it again because maybe you missed something. We'll see you next week.